Entamoeba histolytica, how man get infected? No, how man get infected? Through fecal-oral route. And infective form is quadrinucleate cyst. It gives rise to amoebic liver abscess. It gives rise to amoebic liver abscess. Malaria caused by 4 species: vivax, oval, malariae, falciparum. Man get infected by the bite of female Anopheles mosquito. It gives rise to fever with chills and rigors. This is called malaria. Now, roundworm is also called as Ascaris lumbricoides. Man got infected by fecal-oral route, by egg present in the water and food. It gives rise to malnutrition, discomfort, malnutrition, discomfort. Then ankylostoma duodenale. How man get infected with ankylostoma duodenale? Ankylostoma duodenale. By walking barefoot on the fecally contaminated soil. Filariform larva enters and gives rise to iron deficiency anemia. Okay, these are the important elements and parasites you should know. Okay. Next is bacteriology, staph, staphylococci. So, what is the morphology of staphylococci? What is the morphology of staphylococci? It looks like grapes. Gram positive cocci in clusters. Gram positive cocci in clusters. Streptococci it's gram positive cocci in chains. So gram positive cocci in chains. Then meningococci, meningococci is plano-convex. It's a gram negative diplococcus. It's a gram negative diplococcus. Then gonococci, kidney shape, and concave and facing each other. Gram negative cocci. Kidney shape, kidney shape in pairs. Okay. Mycobacterium tuberculosis, M. tuberculosis, long, slender, bleeding appearance. It causes tuberculosis. 70% of cases. Shall I use that this thing? PowerPoint. Let us see which check if it comes or not. Arboviruses, arthropod-borne viruses. It's not coming. Viruses of vertebrate transmitted by vectors. That is mosquitoes, ticks, flea, rat flea. Okay. They are throughout worldwide in distribution. Mosquito and ticks. Okay. They are isolated by in the brain of the mice, intracerebral inoculation in the mice, and cultivated in the yolk sac or CM, coleontine membranous chick embryo. They can be cultivated in tissue culture, chick embryo fibroblast, vero cells, and HeLa cell line. Arboviruses are heat labile inactivated by bile salt, either bile solvents. Okay, okay. See, they are have got hemagglutinin. Hemagglutinin means they agglutinate RBCs and they fix the complement and neutralize antigens. They are integral part of the viruses. And plaque reduction neutralization test shows high specificity of arthropod viruses. So man get infected by the insect of the bite. Either the tick or mosquito enters the human body, multiplies in the reticular endothelial system. They will be seated in the blood. They gives rise to viremia. And they infect the central nervous system, causes encephalitis. In fact, they go to the liver in yellow fever, causes jaundice. Capillary endothelium causes hemorrhagic fever. So toga means bark of the tree. Toga means bark of the tree. They are classified under toga viridis, flaviviridae, yellow colored, bunia viridae, rio viridae, and rhabdoviridae. Alpha virus, flavivirus, bunia virus, flavovirus, nairovirus, hatana virus, orbivirus, vesiculovirus. Toga viridae. They are specifically spherical, enveloped single stranded RNA. Viruses measure about 50 to 70 nanometer. Alpha viruses and ruboviruses. Now, alpha viruses, they are 32 mosquito borne, produce encephalitis in America and dengue like fever in tropics. Encephalitis causing virus. They causes encephalitis in horses and humans. Culex, Anopheles mosquitoes, reservoir wild rabbits. Example is eastern and western equine encephalitis. Eastern equine encephalitis is confined to eastern Canada, USA, and Caribbean. Western is confined to America, Venezuelan, Central and South America. Chikungunya virus. This can be asked as a short note in your examination. Chikungunya. So it is isolated from in human and transmitted by Aedes aegypti. Remember this. Aedes is transmitted by Aedes aegypti. It is transmitted by Aedes aegypti. Clinical presentation, it is sudden onset. It is a biphasic period with remissions after 1 to 6 days, crippling joint pain, lymphadenopathy, and conjunctivitis and maculopapular rash. Maculopapular rash. So, everybody repeat with me. Chikungunya is transmitted by Aedes aegypti. First time isolated in Tanzania, 1952. So, what are the clinical features? Sudden onset of biphasic fever. Remember, biphasic fever. Two sets of fever come in, and in between the person will be alright for a week. First there will be fever. In between for a 1 week, patient will be alright. So again it after 1 to 6 days again it comes. So biphasic fever. Remember, chikungunya for biphasic fever. How many? Bi means two. Two sets of fever at the interval of 1 week. Biphasic fever. Everybody say biphasic fever. Two sets of fever at the interval of 1 week. Two sets of fever. Biphasic means two sets of fever at 1 week interval. Biphasic means crippling joint pains. Hold up. Chikungunya means hold up. This also. You can dance. Hey, do it. Exercise. This also. Joint pain. Arthritis. Joint pain is medically termed as arthritis. Arthritis is joint pain. Lymphadenopathy. Hold this. Lymphadenopathy. Lymphadenopathy. Lymph nodes. Lymph nodes get enlarged. Conjunctivitis. Conjunctivitis. Maculopapular rash. Rash on the body. You don't put surma. Don't. Eye make you don't do. This and this you don't do. Okay. So it occurs as epidemic in African countries. In 1963, India, Calcutta and Chennai. 73, east coast of India and Maharashtra. 206, it occurred in Andhra Pradesh, Tamil Nadu, Kerala and Karnataka. No animal reservoir. Laboratory diagnosis of chikungunya. Laboratory diagnosis of chikungunya. It's the most common approach. You have to do enzyme-linked immunosorbent assay for IgM and IgG. Real-time PCR or reverse transcriptase PCR. No vaccine is available for chikungunya. Other virus belonging to this group is Onion virus, Japanese, Semiliki forest virus, Sindibis virus. Now, flaviviridae, it consists of they are mosquito-borne or tick-borne viruses. They cause encephalitis. Hold like this. Encephalitis. So, St. Louis encephalitis, Elias viruses, West Nile viruses, Murray Valley encephalitis. Now, this is very important. This is present in India. Japanese bee encephalitis. Japanese bee encephalitis. Japanese bee encephalitis is present in Korea, Japan, Indonesia and Malaysia. Japan, Korea, India and Malaysia. Vector is Culex mosquito. Culex Tritonor intestine. 5 times you tell. Culex, 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 Culex. Not clueless. Culex. Culex Tritonorinctus. Try Fee, no ring test. Straighten ring test. And reservoir host is herons, birds herons, not heroine, herons, herons. Pigs are amplifier host. Clinical features: fever, headache, and vomiting. Fever, fever. How will you show fever? Enact and sure. Yes, sir. Headache, headache. You should tie something. Why you are wearing mask? Mask. Why you are wearing mask? Answer my question. Hmm? COVID-19. It is 2000. Clinical features: fever, show like this, fever, headache, headache, vomiting, vomiting, how will you show? Fever, headache, vomiting. Incubation period is 1 to 6 weeks. Knuckle rigidity you have to show like this. When you do this, you cannot bend. Knuckle rigidity is neck rigidity. Knuckle rigidity. Convulsions, how will you show? Convulsions, how will you show? Convulsions, altered sensorium. Must have seen in movies after some, when he gets up, मैं कहाँ हूँ, where I am. తెలుగులో ఏం చెప్తారు after some time when he gets up? Where I am. मैं ఎక్కడ ఉన్నారు, very good. Neutrophilia, increased cell count. Neutropenia is less. Penia is less, philia is more. Neutrophilia, slightly raised protein in CSF. Mortality is almost, if 100 people get infected, 50 people will die. How many? 50. You know what is 50? Can you count 1 to 50? Very good. Very good in mathematics. But so how to control this mosquito? What is the anti-mosquito spray contains? You want to kill mosquito, what you spray? It contains what? It spray contains what? Most commonly used mosquito repellent mosquito spray is DDT. DDT. Control of amplifier host, pigs. Vaccine. Formalin inactivated mouse brain vaccine. Nicama strain is used for protection. Nicama strain is used for the protection. JE strain, SA14, 14, 12. What is vaccine? What is vaccine? Vaccine means what? Which branch you are doing? All your physiotherapy or you are allied. What branch you are doing? Cardiology. All your physiotherapy. Yeah? 1, 5. You are radiology. How many are radiology? Raise your hand. 1, 2, 3. You are cardiology. Nice job you'll get. You pass. Lot of demand for radiology. I think must have given more money, I think, for the seat. No, how you got it? Government seat. What is the fees for government seat here? Management. Management seat? 80. 80 or 1 lakh. Where is? 3 years means 3 lakhs. Or total package? 1 year. It is 4 years, no? 4 lakhs. Huh? 3 years. After PUC, no? Okay. Physiotherapy also good demand is there for strokes and so many things. Any more employable than doctors nowadays. Good. You are supposed to know vaccine or no? Sometimes physiotherapists in smaller areas, rural areas, act as the doctors. Physiotherapists are also called get a prefix doctor. You know that? Yes, sir. What vaccine you have taken in the recent past? Hmm. What is the morphology of hepatitis B virus? There are two types of important hepatitis that infect man. Hepatitis A, hepatitis B. What is the difference between hepatitis A and B? What's your name? Mohitya. What is the meaning of Mohitya? Pura. Pearl. What kind of pearl? Black pearl or pearls are white only. Eh? Black pearl was a Pele, but footballer called as black pearl. Eh? You don't know? Okay. What's your name? Huh? Nandini. Nandini milk products are in Bangalore. Their dairy products are called Nandini products. Okay, sit down. Vaccine means what? Vaccine is. What is the meaning of vaccine? What is immunization? Very important. Attendance is very important. Vakka means what? You know the story, eh? Come here. Tell. Come. Remove mask first. Tell the story. Tell the story about cow. Alexander Fleming, penicillin. Alexander Fleming, penicillin. Total wrong. Then I will me ఇంగ్లీష్ టు తెలుతాము మీన్స్ వాట్ మా ఇంగ్లీష్లో చెప్తాను నీ తెలుగులో ట్రాన్స్లేట్ చేయి ఓకే వెరీ గుడ్ సిడౌన్ ప్లీజ్ సిడౌన్ దెర్ వాజ్ అ పర్సన్ కాల్డ్ సర్ ఎడ్వర్డ్ జన్నర్ డాక్టర్ ఎడ్వర్డ్ జన్నర్ వాట్ పర్సన్ కాల్డ్ he suffered from smallpox, which is a very deadly disease, at the age of 9. First, it all started in India, where people used to practice variolation. The story started with India and China, where people used to start variolation. They used to take healing scab of the smallpox, make it a powder, and insufflate it into the nose. తెలుగులో చెప్పండి. Okay. Now, slowly, but it used to contain live viruses. People used to die. So once milkmaid told that she has suffered from cowpox, she will not suffer from smallpox. What she told? Cowpox is caused by vaccinia virus. Caused by smallpox is caused by variola virus. Both are antigenically similar. Both are antigenically. So he got the idea. He grew the virus on the udder of the cow, cowpox virus on the udder of the cow, and got hold of a boy called Joseph Mister. He vaccinated him with cowpox. Subsequently, he challenged with the smallpox, variola virus. Boy survived, and there was a lot of fight. Everybody called him a fool, idiot. How can an animal virus protect the human virus? So they made play card and said he should be banned from practicing medicine and all. He used the forest and he created a house and he started vaccinating from there. And it moved to the US and came back to the London. Now everybody is mandatory. The moment now it's totally eradicated, global eradication of smallpox. Now there is no vaccine. So everybody repeat with me. Prophylactically given vaccines are called, antigens are called vaccines. Prophylactically given antigens to prevent infectious diseases are called vaccines. This vaccine term is derived in the memory of Dr. Edward Jenner, who discovered that who discovered smallpox vaccine and eradicated smallpox from this world. There is a vaccine against polio also. What is the name of the vaccine for polio? Polio vaccine. Yeah. BCG is for tuberculosis. Long form of BCG? Long form of BCG? Long form of BCG. BCG. Bacillus. Bacillus Calumet urine. Bacillus Calumet urine. Here, bovine strain of tubercle bacilli attenuated given to prevent human tuberculosis. Bovine strain of tuberculosis. Poliovirus vaccines. There are two virus vaccines available. One is oral vaccine, another is parental vaccine. One is oral vaccine, another is parental vaccine. Oral vaccine is called Sabin vaccine. Oral vaccine is given Sabin vaccine. And parental vaccine is called Salk. SALK, Salk vaccine. Parental is called Salk vaccine. DPT vaccine. DPT. And D and T are toxoids. D and T are toxoids. How do you convert toxin into toxoid? How do you convert? Diphtheria is what? What is diphtheria? What you heard diphtheria? You know diphtheria. What is diphtheria? Whooping cough is caused by Bordetella pertussis. Diphtheria is caused by Corynebacterium diphtheria. Diphtheria is pseudomembrane in the diphtheros means leathery membrane in the throat. Leathery membrane in the throat. What is tetanus? What is tetanus? What is tetanus? Tetanus follows the small injuries or if you take a shave with the rusted blade or thorn prick or rusted needles. And very common it occurs in the neonatal period and when they cut the placenta with the rusted scissors. Scissors yani in Telugu scissors? Kattira. So most of the time there are home deliveries and hospital deliveries. Most of the time in India we don't have enough beds to deliver women in the hospital. We usually use delivery in the home. Usually, an old age woman will be there who comes and delivers. Most of the time, the scissors that are used are not sterilized. Cut the link between the mother and the child. So, end up with the tetanus neonatal. Tetanus neonatal. So, toxin is converted into toxoid by addition of formaldehyde. Toxin is converted into toxoid by addition of formaldehyde. Diphtheria pertussis is caused by whooping cough. It is caused by an organism called Bordetella pertussis. What is the organism? It is called as Bordetella pertussis. And it is called whooping cough. It ends with woof. That's why it's called as whooping cough. Nowadays, it's not very common because of immunization. Good immunization program that's going on. That's not a problem. Then we give hepatitis B vaccine. Hepatitis B vaccine is also called as anti-cancer vaccine. All of you have taken 3 doses of vaccine. Sure. Raise your hands who are not taken. 2 only taken. No. One, you started going to the hospital? Yes or no? Before going to the hospital, you should all immunized by the hepatitis B vaccine because 35 crore in this world are suffering from hepatitis B carriage, equivalent to the population of US. Once you get hepatitis, acquire hepatitis, and you'll not get rid of this virus throughout lifetime. And in old age, you can give rise to cirrhosis and hepatocellular carcinoma. Very dangerous viral diseases in healthcare workers. So, and it's very important that all of you should get immunized before you touch the patient. Before you touch the patients, all healthcare workers should get immunized against. So you are the people who are stay most of the time with the patient. You take care of them, and for example, stroke. You have to take care of bladder, bowel, and the bed sores. All those things. It's very important. Physiotherapist is very important in terminal illnesses when the patient is very sick, not able to eat, not able to drink, not able to do any work. When he is bedridden, you are the people who come into the action. And most of the time, all the patients are infected to you. You should be very careful taking care of yourself, not get infected by the patient. So you should use all precautions, what we call as universal precautions. You should wear, especially gloves are very important and goggles. Sometimes viruses can enter through conjunctiva. That's very important. Important part and parcel of your protective gloves. That's very important. Okay, now moving on to the hepatitis B vaccine you should take. It's a DNA recombinant vaccine. We give antigen which consists of hepatitis B surface antigen. You have to take 3 doses, 0 if you take today, 1 after 1 month, 1 after 6 months. You are immunized for 5 years. And every 5 years you go on taking booster doses. That's very important. And once you take immunization, you should check for the antibody titer. 1 in 10 IU per ml or 1 in 100 IU per DL is protected. So you should go on checking once if you come across a lot of needle stick injury in hospital practice. The moment you get needle stick injury, you should come to the microbial department and tell that you got a needle stick injury, and you should take precaution against hepatitis B, hepatitis C, and HIV. Anti-HIV drug should be taken immediately within 24 hours after the needle stick injury. That's very important. If you don't take within 22 hours prophylaxis against HIV, you really get infected with HIV. And it becomes totally useless if you take after 24 hours. At least within 72 hours, you should start antiretroviral drugs. Hepatitis B should get all immunized before you touch the patient. Even time, some super carriers, even the sweat, if you got abrasion in the hand, even sweat can transmit the infection to you. So it's very important that all of you should get immunized and an hepatitis B vaccine before you enter the hospital. We have made a protocol that all the medical students, dental students, nursing students, allied health students should get immunized before they touch the patient. That's very important. And all of you should wear good shoes, not this slimpy Hawaii chappals. Good, thick, because so many times the needles are thrown on the hospital floor, you will get needle stick injuries. And while giving injections, whatever procedure you are doing, you should be very protective about your hand. So you should be very careful that you should not get needle stick injury in hospital environment. That's very important. Three important viral diseases, bloodborne viral infection that are transmitted are hepatitis B, hepatitis C, and HIV. Write down needle stick injury, NSI. Hepatitis B, hepatitis C, and HIV. What is hospital acquired infection? HAI. Hospital acquired infection. What are hospital acquired infections? Yes, Mohitya. Hospital acquired infection. Who said this? Please do not give infection to already sick patient. Please don't do any harm to already sick patient. Patient gets admitted with cancer, diabetes, hypertension, road traffic accident. Please don't do any harm to already sick patient. Who said this? You're all part and parcel of healthcare hospital. You should take care of patient should not get infected by you or hospital environment. There are four. Hold it like this. Hospital acquired infection. First one is catheter associated urinary tract infection. When you put catheter, you get patient will get catheter associated urinary tract. Next is VAP, ventilator associated pneumonia. Ventilator associated pneumonia. The third one is surgical site infection, or it's also called as post-operative wound infection. The fourth one is BSI, bloodstream infection. You put catheter and all those things. No? Through catheter, organisms will give. So repeat with me. Corti VAP, SSI, BSI. Corti VAP, SSI, BSI. Corti VAP, SSI, BSI. Corti VAP, SSI, BSI. Thank you very much for patience. If you come regularly, we'll revise all your question paper, previous year question paper in nutshell. Okay, what you are supposed to write and how you approach the question paper and all. Okay.